Many blessings and welcome back to Curlin Drums Presents. I am Curlin Drums, also known as the Talking Drum. I'm here with Dr. Matthews of Rainbow City Chiropractic. How are you doing
I'm
today?
doing well. Happy New Year.
Same to you. Thank you so much. Now, we're going to go ahead and go through part two of chiropractic medicine. The first part we discussed all the information as it relates to health and wellness benefits of going to see a chiropractor. And now we're going to get into some tools of the trade and also um, going through me getting an actual adjustment. All right, so Dr. Matthews, take it away.
Absolutely. Thanks so much, Carolyn. Today we're going to learn about a few of the tools that I use in this office in Rainbow City Chiropractic. Now, there's a plethora of chiropractic tools that are out there. However, I stick to the basics because for the most part, chiro, again, means hands and practice means to practice. So I practice with my hands. So these are the first tools of the practice that I use the most, at least 90% of the time. I am what they call an old school chiropractor. I use my hands to move the bones more so than other apparatus type structures. Now, this next tool that I have, because not everybody can take the original form of chiropractic, so we need a gentler type of chiropractic care that's still very effective in the long run, not so much in the short run. And so this is called the activator, okay? And we use the activator to get on the smaller bones of the human body. So for like infants, toddlers, for the geriatric or elderly retirement age person, or someone who is just so apprehensive about chiropractic, we use this technique right here, the activator, and it's simply just a small, we find the area and then we just give it small clicks. So a lot of times my patients call it the clicker. You're only in one position when we use the activator, and there is a protocol for the activator, so we can actually do muscle testing for specific bones in the spine to tell if they are or are not out of alignment using the activator method with this apparatus here. Now, the third tool that I use in here, of course, is the table itself. Okay? Now, this is someone lying on their stomachs. Okay, just picture that. So here's the butt bones here, hip bones where you put your hands when you're mad at somebody. Here's the lower back here, mid back, and then the neck, and of course, this would be the back of the head, and we'll show you on Carolyn what we're talking about. Now, basically, when I use the table can come up in various positions, just like that. And so with my force on the hips, let's say, I can actually, let me loosen that up. I can actually push down. Now, what that means is the noise shouldn't scare you. We'll warn you that there is noise and things like that. But what happens is my force goes through your body and into the table, and it drops the table for a gentler chiropractic adjustment, but you get the benefit of the adjustment. So again, we just push here, or push here, and we use the table again to help move the bones so that you're feeling a lot better. And this technique actually is called the Thompson technique, and even in the neck, we can move that so that we can keep you in one solid position, or maybe a left turn or right turn of the head, to make sure that we can gently adjust your spine with buffering the force, so to speak. And so one other apparatus that I use also is the muscle traction. Okay, it's really just, it looks like a car buffer. Okay, but what we do is we traction that up and down the spine to get the nerve really going. Sometimes an effect of that would be your back would start to itch just a little bit, and that's just the nerves getting going, and that's exactly what we want. And of course, my EMS machine, electric muscle stimulating machine, that we put on you with various pads and whatnot so that we can stimulate the muscles in different areas, always according to your intensity. So there's no pain, no gain. We don't have that motto here. And that's just a few of the techniques and tools that I use for the trade of chiropractic.
Wonderful. Well, Dr. Matthews, thank you so much. And now it's time for me to get on the table to get my adjustment for the new year. Yeah, and I know there's going to be a little bit of a history there because my back is hurting a little bit. So let's just go ahead and get started with that.
Okay, so now we have discussed the different tools of the trade of chiropractic. And so here comes an actual adjustment on an actual patient. And this is Karen Oakley, as you all know. So basically, a lot of chiropractors, we start from the back here, and we try to measure your feet. And the reason why we do that is we want to see how the body is balanced or unbalanced, okay? And right now she has a left short leg, maybe 1/4 of an inch, a little more on the left side compared to the right side. So now we want to see how that looks, just like that. And this gives us a reading of our hips, okay? Now, this left side heel was a little higher, so that tells me to come over to this side on this hip here and to go ahead and adjust it. I'm going to use the Thompson technique, or a drop table technique. And like I mentioned before, the table comes up, we measure your weight so you'll fall, just like she did there. And then I'll come in here and I'll just give thrust, just like that, putting that bone back where it needs to be, just like that. And 3 is usually the protocol. And then we always want to come and check, and as I can tell, she's nice and even there, so we have eliminated that subluxation or that misalignment with the hip there. So now her tailbone I'll evaluate, and that's the tailbone, that's what you sit on, as far as, or that's the stool that your spine sits on, I should say. Lift this leg straight up in the air for me, just like that, good. And other side, just like that. So it's pretty even there, so there's no need to evaluate any further. And so again, we come back and we check, and now I come here. It's just a standard technique that I do with everybody, because a lot of sitting on computers that we do. So there's a standard adjustment that I do no matter what. And I'm just pulling the tailbone back. So in other words, what I just did was, here is the tailbone right here. And sometimes our tailbone, which is what the spine sits on right here, falls towards our belly button. So that technique there just kind of brings it back out, because a lot of our lifestyles now are sedentary work lifestyles, where we're sitting and working for a number of hours. And so now we're going to move up into the lower back, and right now just palpating. I'm looking for misalignments, feeling for misalignments. Right there versus right there. This is all in the lower back. So now I'm going to have her roll on this side facing me. I'm going to have her put her ear right on that paper there. Watch your scarf. There you go. Just like that. And now we move to more so the diversified or hands-on, or more hands-on chiropractic care. Just like that. Patient position is always very important. It's 90% of the adjustment. So we always want to make sure that the patient is in the proper position. Okay? Now we'll have her head turn this way. And then basically what I'm doing here is just bringing her over, just like that. And then we're adjusting the lower back in that instance. Okay? We're going to do the same thing on this side, so she'll turn towards me. And again, it's all about the patient position, just like that. On your back. Okay, so now we've adjusted the hips already. We've adjusted the lower back. We've taken care of any tailbone issues falling towards the belly button. And so now, sometimes there's different techniques that we use to adjust the middle of the back and whatnot. And Carolyn has a preference. Okay, so you can go ahead and turn over. And so now I'm going to use the activator technique, which is I come in here and I measure the force that I want, and I find any anterior. So what are anteriors? It's where your mid-back vertebrae have kind of fallen towards your chest a little bit, and so there's little tiny tender spots or dips in the spine, like right there for her. So I just come on each transverse process and then on the spinous. And this really allows me to be a lot more specific And we just go right down the line here. And it's really all about feel. It's up to the chiropractor. We just want to make sure that we're very thorough with the area with this clicker. Very good. Turn over on your back for me. So you can mix techniques up when you are adjusting. I like to stick to one technique throughout, but you can do it if it gets the job done. And with a lot of people, yes, you will have to switch techniques because some are a little more apprehensive about others. They're a little more uncomfortable with other positions. So your chiropractor has to be versatile in his technique knowledge. Okay. Now we're going to adjust the neck, and that can be a very sensitive area. We're going to adjust the neck, and that can be a very sensitive area because a lot of people don't like to have hands around their head or their neck and whatnot. However, your chiropractor should make you feel very comfortable about the neck adjustment. You're not going to break anything. You're not going to. You're not in grave danger when someone does a neck adjustment. As with any medical procedures, there are risks that you take and whatnot. And the risk here would be a stroke, but you'll probably win the lottery before you have a stroke in a chiropractor's office from a neck adjustment, okay? So basically, we just get right here, and she's a little nervous today because I can feel, yeah, there you go. There you go. And we're always palpating, feeling for the subluxation, right through there, and she'll relax for me. Just like that. It's just a quick motion of the hands. And the popping that you hear or the cracking as you hear, there's no cracking in the office because we'd be in a lot of trouble. And just relax, my dear. Just like that. Okay? And that is the adjustment. She can now come up. And she's all done.
All right, well, Dr. Matthews, thank you so much for the adjustment.
Absolutely.
Appreciate it.
I
hope you
appreciate
all
you coming
learned, oh, not a problem, and I hope you all learned something really great. If you haven't been to the chiropractor, go. It's wonderful for the body. Many blessings.